All right, good morning, everyone. Thank you so much for being here. My name is Bruce Clash. I am the Pennsylvania State Director of Fight Crime, Invest in Kids. I partner with 250 Pennsylvania police chiefs, sheriffs, and district attorneys to get kids off on the right start so they never head down paths of criminality in the first place. I am also co-chair of the Public Engagement Committee for the Pennsylvania Lead-Free Promise Project, a growing coalition of over 60 statewide organizations that are dedicated to ending the ongoing bane of childhood lead paint poisoning in Pennsylvania. Lead-Free Promise partners include law enforcement organizations, healthcare, health insurance providers, pediatricians, housing authorities, municipal governments, social service entities, education and business leaders, civic and community organizations, childhood advocates, and others. While many people believe that lead poisoning is an issue in the past, the reality is that the lifelong potential of children is compromised for nearly 7,000 children annually in Pennsylvania who likely have lead poisoning, according to the latest data available. That number is actually quite low, likely, since less than 20% of children under age 5 are tested each year. And even though lead paint was banned in 1978, about 70% of Pennsylvania's housing stock was built before then, meaning that unless older homes in rural, suburban, and urban areas have been effectively remediated, paint chips and dust may be lurking in homes and other places where children live and play. But children are also exposed to lead from other sources as well, such as lead paint on toys, from contaminated soil, water and lead pipes, and even foods like the recent applesauce recall that we heard about where children were contaminated with lead paint. But in Pennsylvania, the primary way that children are poisoned is through ingesting lead paint. Our goal today is to call for 2 steps Pennsylvania can do now to protect more children from the ravages of lead paint poisoning. The first is for the full Senate to take up Senate Bill 514, which was introduced by Senator Lisa Baker, and we're grateful for her continuing leadership on this issue, and it's backed by broad bipartisan support. It would mandate that all children under age 2 are tested for their blood lead level with a parental opt-out. It passed unanimously by the Senate Health and Human Services Committee. We just need the full Senate to act on it. The second step Pennsylvania can take would be to include $1.5 million for the Department of Health in next year's budget. The Department of Health is mandated by previous law to conduct a public education campaign about the hazards of lead. We need to have this campaign funded so more parents and healthcare workers can understand the dangers of lead. So I'm pleased to be joined by several other experts and speakers this morning. Dr. Harriet O'Katch, Dr. Christopher Russo, State Representative Donna Bullock, and Dr. Kara McGroarty as well. And I'll introduce each now. The first to speak this morning is Dr. Harriet O'Katch, is Assistant Professor of Public Health at Thomas Jefferson University and co-chair of the Public Engagement for the Lead-Free Promise Project. Dr. O'Katch holds a PhD in analytical chemistry from the University of Botswana and a Master of Public Health at the University of Pennsylvania. It is my pleasure to introduce Dr. O'Katch.
Thank you so much. On this morning, I greet you all. As has been mentioned, I am an assistant professor of public health at Thomas Jefferson University, and prior to that, I was at Franklin and Marshall College in Lancaster. In the last 6.5 years, I have engaged with organizations and with communities as I've worked on various research projects around lead poisoning prevention. And in all this time, while I've maintained a smile on my face doing this work, I have been saddened that lead poisoning, a condition that is 100% preventable, continues to affect young children and who will potentially remain impacted into adolescence and into adulthood. Homes built before 1978 are known to be a risk factor for lead poisoning. And a recent article reported that in Pennsylvania, the housing stock is the fourth oldest in the nation. The American Community Survey specifically estimates that about 66% of Pennsylvania homes were built before 1978. 1978 is a significant year for us because this was the year that lead-based paint was banned. But any child who lives in a home which has lead-based paint is at risk of lead poisoning. About 70% of all lead poisoning cases actually come from lead-based paint. And this is in the form of lead-based paint chips, flakes, and even dust. In Pennsylvania, over 7,000 children are affected by lead annually. Typically, children in families that are low income or that might identify as a minority group and who are renting are more likely to be impacted by lead-based paint. It is therefore actually worthy for us to note that we can protect these children. And the primary way of doing that is by removing lead from homes. The Department of Housing and Urban Development does provide federal funds for lead-based paint remediation in homes, but unfortunately not all counties and municipalities are able to attract this money because it is competitive funding. About 15 counties in Lancaster, in the state of Pennsylvania, have been awarded these funds, and they've done a lot of work to remediate homes. Furthermore, Lancaster General Health, Penn Medicine, in 2021 made a unique investment of $50 million to remediate paint from 2,800 homes. This is the first corporate commitment to residential lead remediation. We also know that the Shapiro administration committed some funds to lead-based paint remediation, about $1.5 million. These efforts represent the best practice to keep children safe and making homes safe as well, especially for families that on their own would not be able to do so. We should remember that every dollar invested in lead-based poisoning prevention can yield at least $17 and even up to $221 and creates a healthier and productive population, which means that we would reduce investments in healthcare and also in social welfare. And so I propose that there are three ways that we can act as a community, as a government, to reduce lead-based paint poisoning. The first is that the legislature can make a commitment to dedicate funds at the state level that are committed for residential lead remediation. Research has demonstrated that when you remove lead from homes, we have lower blood lead levels in children who live in those homes. The second thing that we can do is we can ask for the governor and the legislature to include $1.5 million for the Department of Health to conduct a public education campaign as required by Act 150 of 2022 about the hazards of lead paint in older homes. Higher knowledge levels about lead can lead to adoption of preventative practices. Third, and my final proposal, is we can promote screening for lead in a child's blood. High blood levels are an indicator that the child might be living in an environment with lead. However, we know that only 20% of children in our state are actually tested for lead. These low testing rates are partly because testing is not mandatory. Senator Lisa Baker has introduced the SB 514 bill called the Childhood Blood Lead Test Act that requires lead testing for all children by age 2. This bill would allow early detection of lead and can inform both the primary care physician and the family how to further prevent lead exposure. So I urge you all to support the passage of this bill. Thank you so much.
Thank you, Dr. Okash. Appreciate that. Our next speaker will be Dr. Christopher Russo, Director of Pediatrics, Women and Children's Services, and Medical Director for Quality and Innovation at WellSpan Health. He also currently serves as co-chair for WellSpan's Spotlight on Children's Health, an initiative that champions the physical, emotional, intellectual well-being of children. So, Dr. Rousseau, thank you so much for joining us today.
Thank you, Dr. Okach. As a pediatrician for WellSpan Health, it is a privilege to serve children and families in South Central Pennsylvania, and to join in this effort to help advocate not just for them, but for all children across Pennsylvania. As a pediatrician, I appreciate the unique value proposition that pediatric healthcare places. The health and well-being of children strongly influences their health as adults. And at its core, pediatrics is about the prevention of illness and early recognition of care opportunities. At WellSpan, we care for all children, from the most fragile infants entering this world prematurely at 22 or 23 weeks gestation, all the way to teenagers ready to enter the workforce and college. For all children, routine care, including lead screenings, is crucially important. Earlier this year, WellSpan launched the ambitious Spotlight on Children's Health initiative to help ensure all children, regardless of race or ethnicity, regardless of the zip code or county in which they were born, to develop in safe, stable, nurturing relationships and environments. It is a critical part of the foundation we are building at WellSpan to advance the health of children across South Central Pennsylvania. But none of us can do this work alone. We are here today to help combat together the problem of lead poisoning in our children. There is no safe level of lead in a child's body, and children younger than 6 years of age, and especially children younger than 3 years old, are more susceptible to the toxic effects of lead. And these toxic effects of lead include permanent cognitive and behavioral deficits. And we know from our data at WellSpan that the burden of lead exposure does not fall equally on our population. For children that we have tested for lead, a non-white child has a 2.8 times greater likelihood of having an abnormal test. This is not acceptable. Unfortunately, each year, as we have heard, nearly 7,000 children in Pennsylvania suffer from lead exposure. That is 7,000 children each year facing the prospect of permanent intellectual disability. 7,000 children each year more likely to develop behavioral problems that will put them at a disadvantage in school. 7,000 children each year failing to reach their potential because of an unsafe environment. And we know, as we have heard already, that number 7,000 only represents a fraction of the children affected, as it is estimated that at least one-fifth of children undergo testing. We can and should do more to ensure all children get tested for lead so they can grow and thrive in safe environments. We are here today to advocate for the passage of Senate Bill 514, sponsored by Senator Lisa Baker, which requires a blood screening test for lead exposure for all children by the age of 2 with parental opt-out. The General Assembly should be commended for taking their first step to address the hazards of lead exposure in children with the passage of a lead testing bill that was ultimately signed into law as Act 150 of 2022. But we need to do more. This session, a stronger effort must be made to make lead testing available for all children. It is estimated that if we tested all children in Pennsylvania, we would identify up to 40,000 children each year with an elevated lead level. That is 40,000 children each year who could have interventions to prevent the toxic effects of lead from further damaging them and other children in the household. That is why, as part of the Children's Health Initiative, WellSpan has taken the proactive approach of universal lead testing screening at 9 months and 24 months. And crucially, introducing point-of-care lead testing at all of our offices so we can make testing convenient and painless for parents and caregivers. I'm happy to report that last year at WellSpan, we performed over 3,000 more lead tests than in the previous year. And we detected over 400 elevated levels than in the previous year. Testing works. It is a crucial means for early detection of elevated lead levels and initiation of mitigation efforts to prevent further lead exposures in the household. I want to thank Senator Baker and other great champions like our next speaker, Representative Bullock, for their leadership and commitment to serving all children across our communities. Thank you.
Thank you, Dr. Rousseau, for that important perspective. And WellSpan and you are to be commended for the amount of testing and work you're doing on behalf of the children in your area. Our next speaker, I just want to acknowledge first that Representative Kahn from Philadelphia area was with us for a little bit. He had to leave, but we appreciate his support. And our next speaker is Representative Donna Bullock, a member of the Pennsylvania House of Representatives, representing the 195th District in North Philadelphia. And she is currently the Majority Chair of the House Children and Youth Committee. Thank you so much for being with us, Representative.
Thank you for that warm introduction, and thank you to all of the advocates, parents, and medical professionals who are joining us today on this very important message. I am honored to be here with the Child Lead-Free Promise Project. Year after year, I have stood on this issue because it is personal. When we bring a life into this world, we look at that small baby and we look in their eyes and we make all these promises to them. We promise to keep them safe. We promise to love them up and love on them. We promise to give them every possible thing they could want and so they can achieve their most wildest dreams. Well, I remember sitting in the pediatrician's office and hearing that my son's lead levels were 5 micrograms per deciliter of blood. 5. It was this number 10 years ago that meant we were on notice, that we should be concerned, that this was something we needed to do something about. He was 2 years old, and I felt like I broke every single promise I ever made to him in his early life. We thought, what could have possibly been different? Our older son hadn't had these concerns. He didn't have high levels of lead in his blood. What was possibly different? And we thought about his daily schedule. Where was he going that was different? Well, he was spending more time at grandmom's than the older one, because when you have the firstborn, you don't let him go out your house. But by the time the second one come, I said, please, take him. But he spent a lot of time at grandma's house, and grandma had a rule: you couldn't write on her walls, but you had a window. You had your window and your brother had his window, and you can do whatever you like in that window. And he would sit in the window and look at birds, and he would actually draw and color and put stickers all in this windowsill. A place where lots of lead paint and dust was just gathering and exposing him and poisoning him every single day at grandmom's house. I felt like I broke a promise. I didn't keep him safe. I didn't protect him. And then I wondered, what does this mean? Now, 10 years later, I don't know if this exposure to lead is the reason why he got a C on his test last week. I don't know if that exposure to lead is the reason why he doesn't listen to me while he plays his video games. But I still and will always have these questions about whether or not that early exposure had done permanent damage, because we know, as the doctor said, that no level is safe. No level of lead is acceptable in our children's blood. So when I came to this building and I decided I was going to be a legislator, I knew that my number one reason for being here was to protect my children and others like them. I call myself the legis mom. I legislate, but I mom hard. And I see myself as the majority chair of children and youth to put all of our children's safety first, and why I have always been an advocate for expanding and making sure that we ensure lead testing as early as possible, because it was that early detection that we were able to take the steps to prevent further exposure. It was that early detection and early testing that we were able to take the steps to make grandma's house safer for him and for others and for grandma. It was that early detection and testing that told me that we can do this and we can correct what had happened and we can keep our children safe. We can continue that promise that we've made to him on the day he was born and make sure we did everything we can so he can achieve his most wildest dreams. It's that early testing and detection that I know saved my child, and why I continue to be an advocate, not just for Senate Bill 514 introduced by my colleague, but for the House bills that have come through the House by Representative Isaacson and Representative Garral. That's why I've been an advocate for more funding, for more testing, for more campaigning and education, so that we can prevent future broken promises. We had a lead-free promise project for our children. Let's keep our promises and do everything we possibly can so that our children can achieve their most wildest dreams without being exposed to lead. Thank you.
Thank you, Representative Bullock. Your testimony just goes to show that there is a role for a partnership with government, with parents, with the community, so that more children aren't having those same experiences that you and your family have had. And to continue that theme, we're going to hear from Dr. Kara McGorty-Durstein. And in addition to being an adjunct assistant professor at Temple University, and Thomas Jefferson University and Ursinus College, she is also a mother of a child that's been severely affected by lead poisoning. And her son's diagnosis is harrowing and heartbreaking, yet it's just one of thousands each year. And so we commend Dr. McGorty-Durstein for sharing her story with us so we can help more families and children not go through what you're going through. So thank you for being here today.
Thank you. Thank you very much, Bruce. As Bruce shared, I am a professor of education, and I'm also the mother of a child that has been lead poisoned. Our guy was a happy, active young toddler. Then we started to notice a change in him. He became easily frustrated, was not developing speech, and was mouthing random objects. We became extremely concerned. Why? As we waited to see specialists, I asked our new pediatrician to run tests because I was extremely worried and wanted to rule out every possibility. Shortly after his second birthday, our son tested positive for lead poisoning. His levels were 27.1. We were in shock. How did this happen? Was our entire home contaminated? Where was the lead coming from? Our pipes, our walls, our woodwork, our soil, our food? Was the rest of our family exposed? We were soon contacted by the Department of Public Health, given a nurse case manager and an evaluator from the county. They visited our home, completed a comprehensive evaluation of our property. Our living space was found to have low to no lead. The only area of significant findings is in our refinished basement, a space we use as a playroom. There was a small space on the stairwell that was damaged from moving. This space tested positive for lead. We hypothesized at some point our very curious little guy ingested paint chips from this space. The cruel irony of lead Such a hazardous substance tastes sweet like cotton candy and attracts little kids to continue to consume it. Had we known, we would have taken precautions and properly sealed this space. We would have prevented his exposure. A $50 can of paint could have allowed us to seal this space. The information was not shared with us. It does not have to be shared with us in Montgomery County. We remediated all spaces identified, paid for additional testing of our home, advocate to increase our son's early intervention supports, and give our son a daily vitamin fortified with D and citrus to help expel the lead from his system. And we hope for the best. We live with a constant worry as we do not know the lasting impact this exposure will have on our child. We now live with constant had we knowns and what ifs. If this was disclosed, if we knew this space was potentially hazardous, how is this going to impact our child's development? If we had known. We cannot individualize or stigmatize this issue. We need funding to ensure robust education initiatives and consistent testing for children to occur across the state. We must prioritize the health and well-being of our youngest residents. Testing does not make this problem go away. It simply makes it worse. Early detention is key. Pennsylvania continues to rank high for all the wrong reasons. Pennsylvania is the second largest number of children testing positive for lead, one of the lowest state contributions to education in the nation, and a lack of special education funding is contributing to high incarceration rates within our state. I simply believe, as Ben Franklin states, an ounce of prevention is worth a pound of cure. We know there is a hazardous material harming our kids that has lifelong consequences. There needs to be more education and advocacy on how lead is an environmental hazard that is still present in our society and will cause children harm. Children or parents and pediatricians need to be informed of ongoing, ever-present issues with lead. All kids need to be tested. These issues cannot be handled county by county. They are issues within rural, suburban, and urban environments. This is a statewide issue that needs statewide solutions. Pennsylvania needs comprehensive policy and stronger laws. Please pass legislation that is in the best interest of the children of Pennsylvania. Every dollar spent is removing lead paint from home saves up to $221 in return over an individual's lifetime. Prevention is fiscally responsible. Support preventative measures and early detection, which could potentially save other children and families from the exposure to hazardous lead and save others from the heartbreak and fears that my family has experienced. While our son continues to grow and overcome his delays, advocating for his needs to be met is a considerable undertaking, a constant battle with our early intervention system in Montgomery County. We know early intervention is important in ensuring positive outcomes for him, yet it is not easy to advocate for him to receive services. Pennsylvania needs comprehensive investments in early intervention. For every dollar invested in early intervention saves estimated 18 over a lifetime. We need preventative measures in the Commonwealth, for it's for the common good.
Kara, thanks so much for sharing your story. All of us here extend our best wishes for you and your son and dealing with his ongoing health issues, and we wish you all the best. So today we stand united in our commitment to safeguarding the health and future of Pennsylvania's children. Our speakers have underscored the urgent need for action to combat childhood lead poisoning in our state. So in sum, lead poisoning, especially through exposure to lead paint, dust, and chips, is still a chronic problem in Pennsylvania. 70% of homes were built before 1978 when lead paint was banned. Almost 7,000 children are poisoned and likely many more each year. Lead damages developing bodies and can cause lifelong impacts. Therefore, we ask the Senate to pass Senate Bill 514 to mandate the testing of all young children under 2 to identify exposure early in their lives. And then we would urge the House to move the bill as well. Finally, we urge the inclusion of $1.5 million in the Department of Health's budget for next year to conduct a public education campaign that could help inform parents and others of the dangers lurking in their own homes. So childhood lead poisoning is a preventable tragedy. Let us seize these opportunities to make meaningful change and protect the children from the devastating impact of lead paint poisoning for a safer future for all. Thank you so much for being here, and thank you all for standing here today. Appreciate it. I can take any questions if there are any. All right, thank you much.